In the world, there are 33 developed nations. Of those 33, only one does not provide universal health care, and that country is the United States of America. The growing financial problem that surrounds medical insurance as well as the medical private sector in the US increases every year as more and more people get crushed under debt from not having a good enough insurance or just not having insurance whatsoever. Now, the right to health care has long been established as a fundamental right. In fact, the United States was part of the council in the UN that proposed that right. And as being part of the founding fathers, as well as being a part of that council, it is the obligation of the US, in my opinion, to fulfill its duties in protecting its citizens by providing universal health care. And yet, in the past 50 years since it's been implemented, the US has continuously failed to implement such a system. Now, since healthcare would be paid by the government, many taxpayers feel that it would be unconstitutional to implement such a system. But the reality stems deeper than that. As a whole, American citizens don't want to give its own money to other people so that they can have this basic fundamental right. The country, the United States, spends more on healthcare as a percentage of the GDP than any other advanced country in the world. However, it has a less life expectancy, higher infant mortality rate, and a higher obesity rate than any other of these developed countries. Now, this is because America's private sector essentially runs the healthcare in this country. So, this basic fundamental right turns into a get money fast scheme by these big corporations at the expense of Americans. Nowhere else in the world will you see advertisements for new pharmaceutical drugs except for the US. That is because healthcare has become a business in the US. And why healthcare companies have spent millions and millions on advertisements just to pull people into the latest product that they're selling. It has no longer become about the consumer but about the person that's selling it. It's become about the corporation. Now, as a country, we often forget that we have a right to watch out for our citizens. And now in the 21st century more than ever do we have the need to evolve into a society that cares more about each other. As a whole, it is time to reevaluate our healthcare system so that the American citizen can live day to day, the average American citizen, without worrying about financial problems from health problems. On a federal level, universal health care actually lowers healthcare costs for the national economy, and that's because the government controls the prices for medications and services. That streamlining trickles down to the doctors themselves, where they're able to reduce administrative costs and hire less staff because they're not forced to work with a ton of healthcare companies, their middlemen, and everybody else in between. Universal healthcare also equalizes service, with no doctors or hospitals being able to target and cater to wealthier clients. This means that everybody gets the same level of care, which ultimately leads to a healthier workforce and a longer life expectancy. When a person has universal healthcare from birth, it can lead to a longer and more healthy life, and it also reduces societal inequality. The only downside to universal healthcare is the fact that the American taxpayer would pay for it, which many Americans would never want to do. That thinking is what put those Americans in debt, as well as it can all be solved with little thinking. In the US currently, around one third of Americans have some sort of medical debt, and of those, 28% owe more than $10,000. Currently in the US, there are somewhere around 350 million people. So take a third of that. Ballpark 110, 150 million people suffer from some sort of medical debt. Those numbers are astronomically crazy. Now, some of those 110, 150 million people do have health insurance, because the reality is that most of these people do have health insurance. It's just the crushing amount of money that these big pharmaceutical companies and these big medical companies put on their prices, because since they set the prices, they can make it whatever they want, so they can make it as high as they want, and people that don't have enough money, or people whose medical insurance copay doesn't give them as much money, really suffer from these kind of things. Now, there are 6 reasons as to why Americans pay more for healthcare as a whole than any other country in the world. Now, this is according to Investopedia.com. First, administrative costs. The number one reason our healthcare costs so high is because 1/4 of our healthcare costs is associated with administration, which is far higher than any other in the country. We have a lot of billing specialists, and we need to make sure that those people know which insurance provider goes to where, and so everything just kind of gets mixed up in translations. Countries such as Canada have a single health payer system, and so they don't require a high level of staffing to administer healthcare. Second, drug costs. Another major difference in healthcare costs between the US and every other developed country is the cost of drugs. In most countries, the government negotiates drug prices with the drug makers. But when Congress created Medicare Part D, it specifically denied Medicare the right to use its power to negotiate the lowest drug prices. Now, the Congressional Budget Office has found that just by giving the low-income beneficiaries of Medicare Part D the same discount Medicaid recipients get, the federal government would save $116 billion over 10 years. Think of what the savings might be if all Medicare recipients could benefit from Medicaid negotiated drug prices. Crazy. Third, defensive medicine. Another big driver of the higher US health insurance bill is the practice of defensive medicine. Doctors are scared that they might get sued, so they ordered more tests and more things when they're uncertain what they know a diagnosis will be. A 2010 Gallup survey estimated that $650 billion annually could be attributed to defensive medicine. Everyone pays the bill on this with higher insurance premium, copay, and out-of-pocket costs, as well as taxes that go towards paying for governmental healthcare programs. 4. Experimental mix of treatments. U.S. medical practitioners also tend to use a more expensive mix of treatments. 17.1% of the United States' GDP was spent on health in 2017. In comparison, the country of Turkey allocated around 4.2% of its GDP in the same year. Further, more people in the U.S. are treated by specialists whose fees are higher than primary care doctors when the same types of treatments are done at the primary care level in any other country. Specialists command higher pay, which drives up the cost for everyone. 5. Wage and work rules. Wage and staffing also drive up the costs in healthcare. Specialists are commanding high reimbursements, and the overutilization of specialists through the current process of referral decision-making drives healthcare costs even higher. The National Commission on Physician Payment Reform was a first step towards fixing this problem based on a 2013 report. The Commission adopted 12 recommendations for changes to get control over physician pay. The Commission has gone on to work with Congress to find a way to implement some of these recommendations, although any policy outcomes have not yet been followed up. 6. Branding. There is no such thing as a legitimate price for anything in healthcare. Prices are made up depending on who the payer is, and this is the biggest problem that the US has. Providers who demand the highest prices are the ones who create a brand everybody wants. In some markets, the prestigious medical institutions can even name their price. This overall pushes prices much higher and makes it less affordable for everybody. The Affordable Care Act has pushed back to some degree against some of the high costs created by branding, but it has not erased all of it. Now, these are just some of the reasons as to why a universal healthcare system must become a reality in America. And yes, we will be paying for each other's insurance, but overall, you would pay less in taxes for a universal healthcare system than you would in one whole year. The average American pays about $5,000 a year in medical fees. You would pay much less than that in taxes, but Americans refuse to accept those times. In a moment like these, like a global pandemic, the need for a universal healthcare system becomes more and more apparent. And I hope you have changed your mind or I have affirmed your beliefs on this statement. Thank you.